Let's talk about periods. We all know they're a natural part of being a woman, but they can also be a bit mysterious. One common question is about blood clots. Why are they there? And are they normal? The good news is that in most cases, those little clots are nothing to worry about. They're simply a sign that your body is doing what it's supposed to do. Think of it this way: your period is like a mini cleanup crew for your uterus. Every month, your body prepares for a possible pregnancy. If pregnancy doesn't happen, the lining of your uterus sheds, and that's what we call your period. Clots are just a natural part of that process. However, it's always good to be informed about our bodies. So let's dive a little deeper into the world of periods and clots to understand what's going on and when it's a good idea to check in with your doctor. To understand why clots happen, it helps to understand how your menstrual cycle works. It's like a clockwork process that repeats every month. Here's a quick rundown. This is when you get your period. The lining of your uterus sheds, and you bleed. Your body starts preparing for ovulation. One of your ovaries develops a follicle containing an egg. The mature egg is released from the ovary. This is the time when you're most fertile. The follicle that released the egg turns into a structure called the corpus luteum, which releases hormones to prepare your uterus for a possible pregnancy. If pregnancy doesn't occur, the corpus luteum breaks down, hormone levels drop, and the cycle begins again. Let's demystify those little clots. Blood clots during your period are simply a clump of blood, tissue, and proteins that are shed from your uterine lining. Think of it like this: when you cut yourself, your blood clots to stop the bleeding. Similarly, during your period, your body releases anticoagulants, substances that prevent your blood from clotting too quickly. But sometimes the flow is heavy, especially in the first few days, and the blood clots faster than these anticoagulants can work. These clots can vary in size and color. Some might be small and jelly-like, while others might be larger and darker. The color can range from bright red to dark brown or even black. Section 4. Why clots happen, the science behind it. Now that you know what clots are, let's understand why they form. As mentioned earlier, during your period, your body sheds the lining of your uterus, and this lining is made up of tissue and blood. When you bleed, your body naturally tries to prevent excessive blood loss by forming clots. Here's how it works. 1. Heavy flow. When your flow is heavy, especially in the first few days of your period, the blood is released more quickly. 2. Anticoagulants. Your body produces anticoagulants, but sometimes the flow is too heavy for them to keep up. 3. Clot formation. As a result, the blood cells clump together, along with proteins and tissue from the uterine lining, forming those clots you might see. It's like trying to mop up a spill with a small sponge. If the spill is large and happens quickly, you might end up with some clumps. Section 5. Normal clots versus cause for concern. Here's the reassuring part. Most of the time, blood clots during your period are completely normal. They're simply a sign that your body is doing its job. Here's what's generally considered normal clot size. Clots smaller than a quarter are usually nothing to worry about. Frequency. Occasional clots, especially during the heaviest days of your period, are common. Color. Clots can range in color from bright red to dark brown or black. However, there are a few instances where it's a good idea to talk to your doctor. Very large clots. If you pass clots larger than a quarter, especially if they're frequent, it's worth getting checked out. Excessive clotting. If your period is suddenly much heavier than usual, or if you're experiencing severe pain, see your doctor. Other symptoms. If you have other symptoms like severe cramps, prolonged bleeding, more than 7 days, or fever, it's important to seek medical advice.